Afternoon, everyone. Thank you all for being here today. This meeting will get started at 12. While you're waiting, if you want to put your name in the chat and where you are, where you're representing, that would be great. Thank you. I can't help myself but to say it's so nice to see so many folks from all over the state of Rhode Island. We're going to give folks a minute to just get into the space. We told everyone we would start at noon, so welcome once again. We are adding names and areas and regions where we're representing, organizations we're representing into the chat as we wait to start this meeting. Thank you. Welcome, everyone, to the Rhode Island Rural Health Transformation Program's educational session. My name is Kyla Walters Clinton, and I have the pleasure of being your guide today. I have the opportunity to serve as the Director of Community Engagement and Equity. So my work entails making sure that we bring folks from all over the state into a space where we can learn more about rural health and the transformation plan that Rhode Island's Executive Office has to offer our community. I have the pleasure today to introduce the Director, Manny Ortiz, who will be facilitating this conversation. And I also bring regrets from our Assistant Secretary, who had another engagement this morning. With that, I turn it over to Manny Ortiz to get us started.
Awesome. Well, good afternoon, everyone. My name is Manny, and it's a pleasure to see a lot of names that I am familiar with, and those who are new and that I have not had the pleasure to meet in person. It's a pleasure to engage you today, and I hope that through the next 5 years of rural health transformation that we'll be able to work together and collaborate. As Kyla mentioned, unfortunately, as the secretary had another engagement today, and so you're here with me today. This is my second week officially as part of the Executive Office of Health and Human Services. Prior to this, I oversaw the Office of Primary Care and Rural Health, the Department of Health, and have been working very closely on this project since inception. Today, I saw that there was a lot of folks that registered, and there was a lot of questions in advance, which are very helpful because it shows how much interest there is in the implementation and the engagement of this project. Today's presentation is really intended to provide a foundational understanding of what rural health transformation is, where the program is headed, and how organizations and communities may engage over time in the project. So without further ado, if we go to the next slide. So I want to do a quick acknowledgement that this program is supported through the federal grant, through the Centers for Medicaid and Medicare Services, and the content that we will go over today, and those are those of the Rhode Island Rural Health Transformation Program efforts and do not represent the views of our federal partners. Go to the next slide. So what is Rural Health Transformation Program? And this is our 101 slide deck. We have done this in the past, but I want to make sure that we set a foundation and then really make sure that at the end of this presentation, we open it up for questions. So Rural Health Transformation was created in Congress in July in 2025 as part of as HR 1. And at its core, it's a federal and state partnership focused on strengthening rural health systems across the country. The intent is not a one-size-fits-all solution, but rather allowing states to design innovative approaches that fit their rural communities. This was a massive grant that all 50 states had to apply for, and all 50 states actually got an award. And we have been very closely working on implementation since early in the beginning of the year, because the awards came out in December. And all states, to be completely transparent, are in the same exact situation Rhode Island is. We are getting ready to get going and get started. And so you will see that throughout this presentation that we we're beginning to move forward with implementation, and that the project has really built on the community engagement that led us to apply. So to understand how this works, it's important to look at the rules that govern the program. If we go to the next slide, we can go over that. So this transformation funding has clear rules on what it can and cannot support. In this slide, you will see that it outlines federal guidelines that define how rural health transformation funding can be used. First, CMS requires that investments support rural communities across at least 3 of the approved categories here in this green box. These categories are intentionally broad and focused on system transformation, including areas like chronic disease prevention, workforce development, behavioral health, technology, and innovative care models. The key takeaway is that funding must be connected back to improving rural health access, capacity, and outcomes, not just maintaining existing services. And if you see, just as important, CMS is also very explicit on what these funds cannot be used for. Rural health transformation funding cannot be used for new constructions or facility build-outs. It cannot be used for independent research and the development of or duplicating services that are already being funded through other sources, or in essence, we cannot supplant. Importantly, this is not funding that replaces existing state or federal dollars. It must make sure that we are using it for transformation. And more importantly, there's also specific caps, including limits to EMR-related replacement costs and administrative spending. What I do want to highlight is that very clear is that this is one-time transformational funding. It cannot be used to close out budget gaps or backfill existing shortfalls. That has been very clear from CMS from the beginning, from the applications. Right? I want to make sure that we put that, because just as HR 1 gave us rural health transformation, it is important in the context of where we're going towards the fall, understanding that there's going to be a lot of challenges also from the HR 1 cuts. If we move on to the next slide, we'll talk a little bit about program structure. So this is a cooperative agreement with shared oversight and accountability between CMS and the state. It is not a typical grant. And what this means is that there's a shared implementation model rather than just a traditional grant where you're given the funds and, at the end, you write a report of what happens at the end. CMS sets the terms and conditions through the notice of award that they provided us, and the states agrees to implement within those requirements and our approved application, which is online, and I encourage all to look at our project narrative. We go to the next slide. We'll actually talk a little bit about what the cooperative agreement details. So, as noted, this is a cooperative agreement, and that means that we work very closely with our federal partners. There's ongoing oversight throughout implementation. We have monthly check-in meetings, actually bi-monthly check-in meetings with CMS, formal quarterly reports, and annual reporting. CMS reviews and approves the state's proposed projects, right? And actually, they already have approved it in our application, and our use of funds, both on the onset and throughout implementation at all times. And that's why we have these reports and these check-in meetings. Most importantly, this is very performance-driven. So continued funding is tied to progress on the milestones and outcomes that we have set in our application. We go to the next slide, we could talk a little bit more about the timeline. So RHTP, Rural Health Transformation Program, is a 5-year initiative running from federal fiscal year 26 to federal fiscal year 2030. This is not a single rollout grant. Implementation happens in phases over time. Future funding is continue and contingent on demonstrated progress against the milestones in our application. Displayed here are some of the key dates in budget period 1. And you can see that budget period 1 is a very, very tight timeline. We received a notice of award in December. We then had, when the state applied, we applied for a $200 million application, which is what was required in the notice of award. And then CMS graded our application and provided funding based on their scoring factors. We were able to receive 156. So the first step we had to do was rebudget to the $156 million. From there, we had to get a budget approved, and then that sets the implementation. As you see, the runway for the annual report is right around the corner. And so all of our states, all 50 states, including Rhode Island, have this very short runway in year 1. But the big thing that I want to highlight here is that the funding that we get in year 1 is not that it has to be spent by the end of this federal fiscal year, which is in October. We have until the next federal fiscal year, and every year will be that way, where funding in one budget period is allowed to be spent all the way to the next federal fiscal year. And this is how this program overall timeline provides you an overview that although there's a short runway, we have time to implement this first grant period that we have received. We go on to the next slide. So there's RHTP itself has been governed by multiple layers of requirements. And at the federal level, this includes the law that authorizes the ability for us to have rural health transformation, which is H.R. 1. We have the notice of funding opportunity that provides us with how and the intentions of how to interpret the program, and then the notice of award that actually provides, here's what you have to do and the deliverables for receiving the award. It also includes standard federal grant rules like the Uniform Guidance under 2 CFR 200 and other CHS requirements. On top of that, there are specific state laws, insurance requirements, and other applicable variation. What this all means that in practice is that the project must be aligned both at the federal and with state compliance frameworks in order for us to implement. And in that, you're going to see that implementation and the way that we engage, because of these frameworks, we have to be cognizant of how our state procures and the engagement that and how we move forward with implementation. So what does RHTP mean for Rhode Island? Let's talk a little bit about our vision for rural health transformation. The next slide. So for Rhode Island, rural health transformation supports a vision of a more connected and community-based rural health system. The goal is coordinated, high-quality care that is available where people live. This represents a shift to more of an integrated community-driven care. There are 5 strategic goals that guide this work, and these goals were from the law and also from the grant notice of application, including population health, access, healthcare access, workforce, innovative care models, and technology integration. So everything in Rhode Island's plan is assigned and aligned to these 5 goals. This is also where some of the questions that we received prior to coming to this, what is it that Rural Health is trying to achieve? And at its core is fundamentally system transformation around access, and intended particularly to our rural healthcare infrastructure. So let's go to the next slide so we can talk a little bit about our broader planning efforts and how it builds on those. So Rhode Island's approach to rural health transformation is not a standalone. It really aligns with existing state strategies like the Rhode Island 2030 plan and the healthcare system planning work that predated the rural health transformation. These efforts all share common priorities: improving health outcomes, expanding access, strengthening workforce, managing costs, and modernizing our healthcare system. RHTP essentially is a targeted investment that accelerates these priorities in our rural communities. Go on to the next slide. So RHTP in Rhode Island, this is one of my favorite slides because it really shows our Rhode Island rural communities. So we received approximately $156.2 million for the first year of RHTP, right? And this is really to support rural health transformation efforts. So in Rhode Island, rural is defined as towns with fewer than 25,000 residents and a population density less than 1,000 individuals. And so when we do that, we have 18 towns that meet this definition, an inclusion of the Narragansett Indian tribe. And I want to pause here because when we think about rural Rhode Island, it's important that we understand the intention of the program and how we are thinking about, and CMS has pushed us to think about, how are we impacting and transforming rural serving, right? How are we serving our rural population? In Rhode Island, this is the map. This is the 18 towns that define what rural is. Now that we have defined and have understood a little bit about how the funding applies, let's talk about how we are engaging partners and shaping the implementation in the next slides. Awesome. So RCP in Rhode Island is being implemented in partnership efforts across multiple organizations, both at the state and at the community level. The Executive Office of Health and Human Services is leading the coordination and is the prime recipient, but the work also involves collaboration across state agencies and partner organizations that, as a group, continue to expand and the implementation efforts moving forward. Again, we talked a little bit about having a short runway. And so this was strategically to create pathways for us to ensure that we can keep the funding, understanding the grant's requirements. Community input was and continues to be a major part of the development process. In the fall of 2025, the state gathered feedback from rural communities to understand the needs and priorities. And that input directly informed Rhode Island's application and what CMS calls our Rural Health Transformation Plan. So as projects roll out, ongoing outreach will be used to ensure that programs and activities, initiatives are working as intended in the communities that they were meant to serve. Go to the next slide. We'll actually talk a little bit about one of my favorite additions to rural health transformation, which is our Rural Health Stakeholder Advisory. So going forward, engagement really continues through our stakeholder advisory committee. And I want to give a shout out to Kyla because she's actually leading that effort, and it's on our website immediately. So you could go ahead and look more about what we're trying to do and actually potentially sign up to be part of that council. And so the Rural Stakeholder Advisory Council is intended to provide a consistent forum for community engagement, share learning, and advisory input as the state moves from planning and implementation. We go on to the next slide, we'll talk a little bit about our initiatives. So in Rhode Island's Rural Health Transformation Plan, there are 13 initiatives that are the operational backbone for our strategy. And they are directly aligned with the 5 goals that you saw on the previous slide. This slide shows how Rhode Island has organized its implementation plan that we submitted to CMS and has been approved in these 13 initiatives. These initiatives are not standalone programs. I want to make sure that this is very clear. They're grouped and aligned under the 5 federal RHTP goals, which guide the overall strategy. Together, they represent a full scope of the system transformation work, including population health, access, workforce development, innovative care models, and technology modernization. These initiatives really came from that input that was provided over the fall. And so in the fall, we received over 300 plus responses to a survey. We also went out to the actual rural communities and held in-person town hall events. We had virtual conversations just like this one. And through all that engagement, we collected a lot of information. Those ideas, those needs, those concepts were grouped by things that are similar to one another. And then they became projects and then became initiatives. So really, truly, this is driven by the community. And so in these initiatives, you'll see that they focus on different parts of the system because this is what we heard from the community. So mobile and community-based services, right? Thinking about how there's one of the challenges in rural health is transportation. So how do we bring think about healthcare delivery from outside of the walls to bringing healthcare to the community. Workforce development. We can't provide healthcare without our health workforce. It's important to invest in them. Behavioral health access, a huge initiative, and you see various strategies, including some that are in our schools with our partners at the Rhode Island Department of Education. Hospital and EMS integration, technology and data, right? Huge components of how the healthcare system. So the intent here is that each initiative contributes to a coordinated system rather than operating in isolation. And more importantly, that they're aligned with what we mentioned in the beginning, the Rhode Island 2030 plan, and also our healthcare system goals. It all lines up together. And we cannot do this without your partnership. So if we go to the next slide, we want to make sure that people understand how to get involved. And I know I went a little fast on this because I want to make sure that we open up time for questions. So what should you expect from us? If you go to the next slide, it'll give you our contact information. And one of the things that we understand is that people want to know, one, how do I fit into rural health transformation? Well, you fit into rural health transformation because rural health transformation is about the delivery healthcare system. And I say we are all consumers of the healthcare system. And yes, it is intended to support our rural communities. But there are the investments that are going to be made, the opportunities with rural health transformation really impact overall the state of Rhode Island. We are a very small state. I like to say we're 40 by 30, and that's what I usually tell people. We can cross the state within 45 minutes. So when we invest in our rural communities, we're really investing in the way that all of us interact with the healthcare system. The other thing is that we'll say, well, how is implementation going to run? Well, it's phased implementation. So you're going to see that a lot of our partners are going to start putting out procurements, are going to start putting out grant opportunities. Those are all coming. We, again, are in the process of getting all of those going. These are going to be in phases. and they'll be out through our state procurement website. So I want to make sure that you guys are in touch. I know you're in touch because you came to this meeting and you registered and you're already connected. One of the things that we want to make sure that you're in touch with is also our community engagement platform that we're doing with the Rural Health Stakeholder Advisory, and more importantly, also to stay connected through our website, because one of our goals is to make sure that you can also see, as procurements and activities and these things move forward, that they're also visible there. So with that said, I want to make sure that I intend time to answer questions and have a dialogue with you today. The next set of the slides, and we could share these already actually posted on our website, are appendix that talk about each of these initiatives in more detail and specifically lay out some of the visions and goals for those within those initiatives. And I know that I'm joined today by some of my colleagues. I will say that I may pick on you as we answer questions just from subject matter expertise. But that said, let's open this up for question, Kyla, if it's okay with you, so that we can engage with folks that are here.